Hi, this is Candace from Sweetwater Offering, and I'm here today to show you the second half of self-care for the lower leg, the calf muscles. Today we'll be talking about the soleus muscle. The soleus is a long, flat muscle that extends over most of the back of the lower leg, but a lot of it is behind the gastrocnemius that we talked about in part 1. The soleus muscle is sometimes called your second heart because as you walk, it pumps the blood up from the lower legs and feet back up to the heart. It's very important for circulation. As we talked about in the first part of this series, trigger points are points of stagnation and tension in a muscle that can send their pain to a different part of the body. And so I want to tell you where trigger points in the soleus muscle send their pain. The most common place is to the heel of the foot. This is a common place where you might experience plantar fasciitis. So they can send pain to the heel of the foot and then back up the backside of the ankle, the Achilles tendon. Something interesting about the soleus is that it can also send pain to the lower back and even feel like deep pain or spasming in the lower back. So it's very important to treat this muscle. Causes of trigger points in the soleus are slipping as you walk or run, such as if you're running on sand or gravel, stiff-soled shoes, pressure from an ottoman or footrest if you're sitting a lot of the time, aerobic dancing, and again, high heels. All right, I'd like to show you a few techniques for how to treat yourself, treat your soleus muscle, and hopefully relieve some pain for you. All right, so to find the soleus muscle, let's remember that it's a long, flat muscle that extends all along the lower leg, but a lot of it is behind the gastrocnemius. And so the best place for us to look first is kind of the end of the gastrocnemius. If you flex your lower leg, you can see kind of the end of the gastrocnemius, and right below there is a good place to start looking for soleus tenderness. And you can do that with your thumbs, pressing the muscle back into the bone of the lower leg. Now, another way to do that is to use the ball. And either of these ways, again, you are looking for a tender point and then holding it there and breathing through it. A third way is simply with the knee of your opposite leg, and you can get pretty deep this way. This is a good way to get some good pressure. And again, looking for a tender point, breathing through it, and then releasing it. Now, another place that you can contact the soleus is right along the inner ridge of your shin here. And you can use your thumb to just feel along for tender points. This is a good way to look if you have shin splints. You can get some relief that way. Also, I wanted to say that some other issues may be compounded by having trigger points in the soleus. Shin splints are one. Another is heel spurs and Achilles tendonitis. All of these, the pain from these can be reduced a great deal by treating your soleus muscle. And finally, I want to show you how to stretch it. To stretch the soleus, you will need to have your knee bent. So you can do this a couple of different ways. The first thing you'll want to do again is contract the muscle and take a deep breath in and then relax. And if you pull your foot back with your knee bent, you can get a stretch that way. And then the other way is similar to how we did the gastrocnemius stretch. You contract the muscle, take a deep breath in, exhale, and then this time when you stretch, you'll just need to bend your knee. tip for you today is that if you take about 5 minutes every morning before you get out of bed to work on your calf muscles, you can have a lot of relief from pain, especially from that morning foot soreness that may happen just when you get out of bed. Give it a try. Could make a big difference. This has been self-care for the calf muscles. Thank you.